Hi, everybody. I'm Ryan Chandler. Here's your talking points for this week. Omicron takes hold. COVID is soaring yet again as we set new records for the most cases we have ever seen. We'll hear from our public health director, Katherine Wells, about what it's like to fight this fourth surge. And Lubbock County investing millions into a paper ballot system they say will make it easier to audit. That requirement comes from the legislature's push for election integrity. But where is the fraud this is supposed to prevent, and how will it change your experience at the polls? We'll sit down with our elections administrator, Roxine Stinson.
From the studios of KAMC Television in Lubbock, your local election headquarters. This is Talking Points with Bryan Mudd.
Happy Sunday, and thanks for joining us, everybody. Well, 3 times this week, Lubbock has broken the previous record for the most COVID cases in a single day. At a time when vaccinations have never been more prevalent and life seemed to be going back to normal in many places, COVID-19 has never been more successful. More than 8,000 people in Lubbock alone contracting the virus in the first 2 weeks of the new year, and our hospitals are starting to feel the strain. Now more than 1 in 5 hospital beds in our region alone are taken by a COVID patient. That's 5% above the threshold that used to allow cities to reinstate additional restrictions. The surge also testing local clinics' ability to test you. Lines stretching around the block at the city testing site this week. Our Katie Gray now joins us with a look at the city's efforts to suppress the surge.
Cars lining the block early Friday morning, anxiously waiting for the health department to start testing for COVID. City Health Director Katherine Wells says the deep drop in temperatures called for the COVID testing site to change their hours of operation.
Delayed that opening for 2 hours, extended it operating time just so that it was easier for staff to be able to swab without having to worry about frostbite or any other issues.
The morning stayed well below freezing, and the wind chill felt like it was 10 degrees outside. But despite the blistering cold, people waited hours to get their COVID test. Other testing sites like Nomi Health, located off 82nd and Homestead, are seeing just as high demand and are asking people to be patient.
So with the different tests that we have, with the antigen test, that one is a quicker test. Usually you're getting your results within an hour. And then if you have the PCR test, we're looking at about 48 hours right now. Just, we ask for that little bit of patience.
While testing sites are facing high traffic and working around weather conditions, Wells says that COVID cases are hitting record highs.
We have a 46% positivity rate at our testing site. So of those, 500 people, 46% of them are coming back positive. We're also seeing about 1 to 2% of those individuals coming back with flu. So I've had, 800 positives from COVID, and in comparison, about 32 positives with flu.
Katie Gray, KAMC News.
And for an inside look at the city's efforts to keep us healthy through this surge, we now welcome our Director of Public Health, Katherine Wells. Katherine, thank you so much for joining us in the studio.
Thank you for having me today.
So I remember the last time we talked about this most recent surge, you said something like, oh man, here we go again. We're doing this again. Depending on how you count it, this is now the 4th time that we've seen a major surge in cases in our community here. So I want to hear from your experience as directing our efforts against these surges. How is this one with Omicron different than ones we've seen in the past?
The biggest challenge with Omicron right now is it is so infectious that we are seeing entire families and workplaces with outbreaks. And it's just the sheer volume and the number of people that are testing and then testing positive. We have some of the highest positivity rates that we've ever seen at our city testing site, and then other places such as the hospitals and those clinics.
What are those numbers that we've been seeing this week, if you know off the top of your head at the testing site?
Yeah, we've been seeing 40, 41, 42% positivity on any day. Prior to that, like a 10 or 15% positivity rate would be considered high.
So that blows any numbers that we've seen before.
I mean, there's more faxes and reports and phone calls coming into the health department. It's almost the same volume of concern in the community that we had early on in the pandemic.
Wow. And how is how is the health department dealing with this increase? Because it seemed kind of unexpected. Once we got through Delta and case numbers declined, and then they just shot up more than we've ever seen. Do you feel that the health department has the resources and the personnel to respond to it effectively?
Well, we're definitely pulling in other city departments. Lubbock Fire and Rescue has been a great partner with the health department, and they've been willing to send out fire staff, especially to help with testing sites, where we definitely need a lot of manpower. Those testing sites have also had like code enforcement, environmental health officers that can get pulled from a day of work to come assist with the health department efforts.
So it's an effort from everyone in the city.
We have police officers out there. You know, staff from even the libraries came in to just assist with paperwork because there's so much volume.
Wow. Are we getting any more support from the state or the federal government for resources that will help us tamp down this surge?
This week we did receive some resources from the Texas Military Department, and they were able to place some officers in to help with traffic direction and some of the paperwork, which relieves some health department staff and other city staff to come back to the office to deal with cases, case counts, making sure that we get the phone answered and those reports out to the media.
Yeah, you know, when we hear Director of Public Health, that is an all-encompassing job title that does not just include COVID, right?
Correct, yes.
I'm sure when you took this job, you did not expect that this would take up so much of your time. So I'm curious to hear how COVID has affected other efforts at the health department. Do you feel like it is taking time and effort away from other important public health measures that we also have to deal with?
Yeah, a lot of the concern is that I've had to pull staff back. So we haven't had staff out doing, you know, outreach and community engagement like we had done previously. I'm also concerned about childhood vaccinations. We haven't had our clinic open just for regular childhood vaccinations as often as we normally do, and then doctors' offices are also full, so it's hard for parents to get in to get those routine immunizations. It's also pulled away from some of our other work around prevention. We do a lot of work around substance use prevention now, so those staff have been pulled into COVID work instead of being able to do their regular daily activities.
Yeah, when you hear about COVID increase so suddenly, so quickly, that in itself is a problem, but it also takes away resources from, you know, other illnesses don't go away, other public health needs don't go away. And it seems that at least with this surge, the initial messaging around it was that Omicron is milder, it may be more infectious, but you won't get as sick. And that seems to have led to a certain degree of dismissal from some people in the community. What do you think the public needs to understand about where we are in the pandemic right now to make sure that we can get through this phase as soon as possible?
Yeah. There are reports out there that this does have milder disease. A lot of that milder disease is in individuals who are fully vaccinated that have that breakthrough case. But I don't want people to become complacent. There are individuals that are going into the hospital, having to have care at the ER, and people that have been very sick for a week or two now. It's not a 2-day cold and you're back at work. We still need people to take this seriously, and if you've been diagnosed, we need you to stay home, and we still need to, you know, work on some of those other prevention efforts, as, you know, limiting large crowds and hand washing and really paying attention to even mild symptoms, and that could possibly be COVID. So really, you know, if you're sick at all, really encouraging people to stay home.
Yeah, it's a new variant, but the same basic prevention efforts stay the same from whether it's Omicron or back in March 2020. You know, I went to go get my booster on last Thursday, and I couldn't believe how easy it was. I just walked into United, 5 minutes later, I was out. What more can the city do to impress that upon people, to convince people who are still unvaccinated to take that step and get either their first shot or their third? And
it's still, you know, our vaccine levels in Lubbock are lower than the rest of the country. We're still around that 53%, and I think we've done everything in this community to make it accessible. Really working on having the city's outreach clinic, you know, that's open. You walk in, fill out one piece of paper, no charge, and you can get vaccinated. Lots of our pharmacies, and then we have other partners that are going out to community centers and setting up kind of one-day pop-up events in different communities to offer that vaccine. We have ample supply of vaccine. Anybody who wants to get vaccinated can go into any of those providers and get that.
Well, that's good news. It's no longer a problem of supply or distribution.
Yeah.
Now it's just a matter of getting the word out and getting people to take that step, right? Just late this week, we heard a number of school districts, I believe at least 10 in our area, including Littlefield, Plainview, Lamesa, Floydada, all closing for at least a day or shutting down athletic events to try and give sick kids a chance to recover and come back to school. Do you think we're going to be seeing more of that? Is that one-day, two-day closures that we're seeing, will that be enough?
I think it will be effective, especially with Omicron, because the incubation period. So we're seeing people get exposed and then developing symptoms very quickly. So even a 2, 3, 4-day break, a lot of people are using the benefit of the holiday weekend so that they can actually have schools closed for 4 days to allow that break in transmission. And there's a lot of staff sick. You know, I know there's a lot of teachers sick. You know, I even have staff at the health department sick now. And, you know, you just need to make sure that we have that workforce that's available to take care of the children while they're in school.
All right, well, hopefully we'll get through this as soon as possible. And again, thank you for all the work that you're doing to help us through it.
Thank you for having me here today.
Thank you. And when we come back, we'll move from the virus to voting. We'll sit down with Lubbock County's elections administrator to hear about state-mandated changes to our election system and how much it'll cost us.